Hello, 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 and welcome back. I am glad to be here sharing with you another inspiring conversation. Wait until you hear my conversation today. It is with Sandy Dorsey, a speech language pathologist, educator, and global advocate for children with special needs. She is absolutely incredible. Whether you are a parent whose child has speech and language difficulties, an educator, or a professional who works with children with learning problems or neurodevelopmental disorders, this episode is absolutely for you. After decades of life experience, my guest found her purpose with reaching children and families globally. She founded Smiles for Speech to help improve the quality of life for children with speech and language disorders around the world. Stay with me for this conversation.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Sandy, welcome to the podcast.
Thank you. I'm so excited to be here.
I'm so glad too. I'm so glad that we are connecting. We were just talking about before we got on that we haven't actually met each other in real life. But sometimes you feel like you do when you've been interacting with people online or in phone conversations like we have had. So it's great to actually see you.
It's great to see you too.
You know, I've wanted to have you on this podcast for a number of different reasons. First and foremost, I have so much respect for you and the work that you do, and we'll absolutely get to that. And second, you and I are both alumni of Howard University.
Hate you.
Go Bisons.
Yes.
So one of the things that impressed me about you is that you're so much more than a speech language pathologist. I mean, you're an educator and really a global advocate and ambassador for children with special needs. I would love for you to kind of share with our listeners your journey from being a speech and language pathologist, which you continue to be, but your journey to advocacy work. I mean, has that always been your goal when you decided to become a speech and language pathologist?
It wasn't a goal as it relates to speech pathology, but I always had in the back of my mind that I wanted to give, and I had a heart to give to everyone in the world. So wherever I traveled, I would end up connecting and somehow to be in a giving, situation. So one of my first trips to Africa was to Senegal, and I was there for dancing and drumming, but ended up connecting with all of these children that would sit in front of my hut in the morning. And the next thing you know, I bought them all this clay and we ended up doing activities. So it's something that's been dear to my heart. And then later on, after 20 plus years in the profession, was able to really, with the speech community, be able to join the two so that speech was a part of it.
Yeah, I feel like there's almost like a calling to do more, and I feel the same way about pediatric neuropsychology where, you and I both have private practices, and obviously we provide services to school-age children who have, in my case, learning differences, neurodevelopmental disorders. Quite a few also have speech and language disorders. But there's almost a point where you feel like, for me, it was like I wasn't doing enough to serve more families. And so like you, I think becoming a resource to families in the overall community became more important.
Mm-hmm. Absolutely. I mean, there's one thing for families to have access to resources, but then there are families that just don't. So that became, a real passion for me to say there are people that don't even know what speech therapy is and think that their child they're born this way and there's just no help. This is just how it is. And through my travels and the more I learn, that kind of enlightenment to the need. You look at the research and what's out there, but the need is huge.
Absolutely. And I think, one of the statistics you actually cite on your website is that 50% of the world's school-age children are kept out of the classroom because little or no money is budgeted for their needs. And, these are kids with cognitive delays, physical delays, sensory learning, speech and emotional challenges. I mean, that's alarming when you think about it on a global scale, right? It seems like overwhelming. Where do you even begin? But you're doing the work. You're reaching families that would not have been reached otherwise and sharing information that is helpful for them.
And one of the first barriers to children receiving the help is the stigma that's attached to having special needs. And that's something that when I started out, I didn't know as much about. And just from talking to families about the ideas that the community has of where, children with special needs are from, whether it's witchcraft or the families are snake children. I've heard of children that have epilepsy and language disorders just being thrown into the river. And I hear so many stories and just really try to learn from families the perspective of the community. So I'm hopeful that in 2022, we'll just do that real push towards remodeling the attitudes that are in certain communities just because of the lack of awareness.
Mm-hmm. And so when you go into those communities where there is misunderstanding and misinformation, where do you start? Because it seems like you have to understand the community first before you can begin sharing information. I think that's the mistake that so many people make, is that they go in and tell people in communities what to do and what they should know. But there's really an art to doing that, and it has to be in a culturally sensitive way.
Exactly. So my approach and the approach that I like for my team to take is to find out what's important to the family. So learning as much as you can about the culture and what's important to them, but how to approach them, which you can learn from other community members. So how is the child seen in the community? What experiences have the family? Have they had positive experiences? What's there for us to first build on? And then the focus is really what they need from their own mouth, not us saying what they need, but, one parent said, I would like to be able to take my child out without them having, a meltdown when they leave the place. So now we can create a little program for them for that one goal, and that can really make a huge impact on their lives. I want to be able to take my child out and not feel ashamed of whatever the child is doing, but helping them to understand what might be involved with the disorder that the child has, and then sharing ideas, I really call it, because they can say, well, this doesn't work for me because of whatever their understanding or approach is to special needs. And we'll say, okay, these are some ideas, not exactly this is how you do it, but these are some ideas that might be helpful.
Yeah. And it seems like listening to how they respond to those ideas, what resonates with them, and giving them the opportunity to decide what would work best for their family.
Exactly.
And I'd love for you to give me an example of the kinds of impact that you're having, because it seems like the work that you do, and I know the work that you're doing, is having a big impact. But in terms of the transformation and addressing that stigma that you mentioned, I think that is, the stigma in particular is such a barrier to getting access to services, or even being willing to ask for what it is that you might need. How do you address that in the work that you do?
Well, it starts, we usually focus on the mother, because most children, or I shouldn't say most, but there are a lot of children where the father ends up leaving once they find out that the child has special needs, and the blame is put on the mother, that it comes from her and her family. So really building the relationship with the mother and showing that we're there, to support her in any way. Is she even ready to talk about what the child needs? Maybe it's a conversation about what she has experienced since giving birth to a child with special needs. What was that experience like, and how can she talk to people in her community about her child? Because a lot of the children are kept hidden in the home. So they might be hidden for their entire lives. There could be that fear of bringing the child out into the community. Is the child safe? And what will happen to them? And she's, the only person that's there responsible. There are the other members of her family that might accept it. But in general, her whole life will change as soon as she brings them out into the community. I think that when we, of course, visit in person, which is different than the teletherapy we're doing, seeing that support from others already is impactful, because they realize that when we take our teams, then they see there are people that are 100% in support of however they're feeling and offering resources. So there's no shame, there's no judgment. And whatever we can offer that's helpful, we're available. So that already opens them up to saying, when they hear that there are other children like this, they aren't the only ones, there's nothing bad about it. We want to celebrate and love your child. And whether it's in person or in teletherapy, I think for the mother to have someone to listen to her stories and see that these stories are valuable, and that it's okay to feel however, she feels, that feeling that she can then take back to the community and say, are there other, the greatest success story is when one mother sees the changes that can happen in her child if she can, follow along with the program that we recommend or that we offer. And then going back to the community and sharing with others that don't know. So it just brings me so much joy when we have one mother that said, everyone's saying, oh, what happened? What happened to your son? He's so different. And then you can say, well, these are the strategies I've been trying. Let me show you. So now that one person that had teletherapy or in person or went to a workshop can share this with the whole community, some who may have never heard of speech therapy. So this happens a lot in Kenya. I had so many calls where people said, we never even have heard of this before. So the word is really spreading, and this is the kind of work that we want to continue so that, yeah.
Absolutely. And it seems like you have a family-centered approach, which has community implications, because you have that family member, that mother going into the community and people observing the change in her child. And it seems like that decreases the stigma, because now the mother feels good about the changes that she has seen in her child. And she's been part of that change because she's been using, tools that you've given her, you and your team have given her.
Which is very empowering. So some of the mothers that we work with, they are creating groups so that they can all continue to spread the word. And then there's a whole group that will be started in Kenya. Just from one parent saying, I will find all of the mothers that I can and bring them together so they can find out this information. And it's not only speech, it's also swallowing. So some of the feeding issues that may lead to malnutrition, it's very important, and they're just not aware. So one of the mothers said, we can really keep families together if more of the fathers knew that it's not because of the mother or her family that this happened and it's okay. And the more mothers that bring their children out in the open, then they can get help.
Mm-hmm. And again, it's all about providing that information to them that they may not be aware of, and dispelling those myths and really helping them to understand some of the misconceptions they might have about difficulties their children are experiencing, whether that be speech, whether that be social communication, whether that be swallowing. And, you'd think that in this day and age that there still wouldn't be that blame on the parent, but in some parts of the world, there still is parent blame, including particularly blame of the mother for the difficulties the child is experiencing.
Yes. And then for those that do know about the services, if they're not able to afford them, that's a stressful situation to know that there are services for your child, but you're just not able to access them. And in some communities, services might mean once a year. Mm-hmm. So we know that they need more than that, and they need the training. So when they can have weekly services, or at least continue to attend workshops and learn themselves, mm-hmm. It's very impactful.
Right. And I know that you do a lot of work overseas, which is fantastic because you're, again, reaching families that wouldn't otherwise have access to the information and the intervention. But you also have a practice here in the United States, and you're doing that work as well. And it seems that when children are really young, if I'm thinking about the work that you do in the speech and language realm, when children are not speaking at all, there's an obvious red flag indicating a delay in language development. But what are, for listeners who might have a child who might be struggling with speech and language issues that, may not be as obvious, what are some other more subtle red flags for parents regarding speech and language development?
So for younger kids, the most important thing to look for is if the child is requesting and attempting to engage. And a lot of the initial work that we start with families is setting up that communication environment where they are learning how to request, and that the mother or the family doesn't automatically get whatever the child wants. So it's about following the child's lead, but then setting up that communication exchange. And this is early on. So they know that if they want something, they're going to have to request it. And that's where the language comes in. So if they're pointing now, we want them to say the word or attempt to say the word. And if the parent has to give the choices of words, we just want them to be set up to turn, take, and for the child to request what they need. That's the number one thing. So if that's not happening, we're concerned.
Okay. And that's obviously in kind of expressing what it is that they need, because I know a lot of families where when you know your child, sometimes they can have nonverbal signals to indicate that they want something. But what you're saying is that give them an opportunity to verbalize what it is that they need. And if you don't see that verbalization, that could be a red flag that something is delayed and there might be some need for intervention. And obviously we talked about how stigma can be a barrier to seeking services, but there are a lot of other barriers as well. And I think one is just, again, having the information, because even what you just said in terms of requesting, many parents may be hearing this for the first time. Those isn't even on their radar, because they might be saying, well, I know what my child needs, because they're indicating what it is that they need. And it seems like, again, having access to that information can be a barrier as well to seeking services.
Right. So if we just say, oh, I know he likes to have milk at 2:00, and then it's there right on the, at the table. Well, there's no need for the child to try to communicate that they want that.
Right. Absolutely. And then also, again, on the other end is just ensuring that your child is understanding information that is presented to them. And Sometimes it can look like an attention or a hearing problem, but it's really, they've heard you correctly. They've paid attention to what you said, but they have no understanding of what it is that you've said because of the words that you've used or the phrases that you've used that they just don't understand.
Exactly. Absolutely. So and the things that you mentioned are all a part of making sure that full evaluation that does involve the speech, the hearing, and all of the other professionals that are needed to get the full picture of the child.
Mm-hmm. And I just feel like as a society, because we know that so many kids get missed and, they may not be identified as having a speech or a language delay or a learning disability or learning disorder until much later. And it seems that we need to do a better job of ensuring that students, particularly those from disadvantaged or marginalized communities, have access to diagnostic and therapeutic services, which is, what you're talking about when you're saying we have to do a good assessment to determine whether it is a speech problem as opposed to a hearing problem or an attention problem. What are your thoughts on how we can improve the lives of children in marginalized communities, in impoverished countries, so that they can live their life to their full potential? I know it's a big question.
Yeah.
There's so much to do, right?
One thing that we started recently is working with actually a neuropsychologist and a pediatric physician in Ghana. And we were talking to her about the stigma and about how some of the doctors are saying that it's okay for the child to not talk until 4. So already the parent is thinking, well, his uncle didn't talk until he was 4 and he's a boy, so it's okay if he's talking later. And really at that point of, the doctor's office, the family saying, well, I don't know who to go to. Maybe they don't know, speech is available. And they go to the doctor. And in some countries, the doctor is saying it's fine. And we know how important early intervention is. So now they're 4 and 5, and all of that time has lapsed. So one of our new initiatives, including a hearing and speech clinic, because in Ghana, the children are not given a hearing screening until they're 5 or 6 years old and in school.
Oh my goodness.
And they're, and this can lead to all kinds of abuse. The parent doesn't realize that they just aren't hearing them. That doctor's visit, there are doctors that aren't aware of where the child should be in certain developmental milestones. This is what we've just been finding out. So the parent comes in and the child may be 5 or 6 and they say, well, the doctor said he was okay. And the child is not talking at all, not a single word.
My heart just dropped when you said that. My heart just dropped because like you're saying before, all that time has lapsed, where there was an opportunity for intervention.
One thing, because when I speak at schools and people say, well, what can we do even locally? And pre-COVID, what we tried to do was speak to preschools. So I'm in New York and Washington Heights. It's mainly a Spanish-speaking community, and talking to preschools about speech and just, what children should be doing or expected at, certain ages is super helpful on a local level.
Mm-hmm.
And then globally, the doctors that we're working with right now just said it's not part of the training. It's just not part of the training. So they're just thinking of what happens in their own family and says, well, it's okay. My oldest daughter didn't start talking until this age. And she caught up and it's okay. So if the training isn't there,
mm-hmm.
the only thing that we're really doing is sharing that information and then working alongside the doctors that do have the training and involving them and sending the child to them to say, all of the different evaluations that can take place are right there in this particular office that we're working with. So doing what we can on our part in a charity, on a charity type basis, and then including the community and the first person that family would see, which is
right.
really the doctor. And
right.
in some countries, they're providing the diagnosis for everything, even though they're not trained in it. And then you have people that are saying that they're speech language therapists, which is what in Ghana and Kenya, the countries we work with, they are called, but they don't have the training.
Mm-hmm. And that's where those collaborations are so important, like what you are doing. You're collaborating and providing education to professionals who are in the position to identify and recognize these delays and these struggles that children are facing. And that is so important. That's such a gift that you're giving communities by giving them this information and sharing it. Because when you share it with one physician, that physician can then, I can imagine, share that information with his or her colleagues as well. And that, again, the whole community benefits.
And then the professionals that may have not had the, outside of the doctors, even for speech and OT, they may not have had the certain classes that we've had. We also collaborate in that way and say, if they say we've never been trained in pediatric dysphagia and swallowing, then we go in and hold a workshop and say, these are the things that may not have been covered in your coursework, and we're happy to share that with you. And then I have an example of a child, a 5-month-old baby who's not eating. The speech therapist in Kenya said, is there anyone that you can set me up with so that will help me, because the child just is losing weight, and 5 days old, actually, in the hospital. So we had a therapist that was a specialist in that area and is now working alongside that therapist. So like you said, she can then talk to the other therapists in the community. And if that comes up again, she can say, these are the things that I've learned. And they're all growing together, because that's the other thing. We're learning from each other. And speech has so many different areas. And we, one therapist can't possibly know everything in every single area. So we're learning from each other.
Right. And I really feel like the key to addressing a lot of the things that we've been discussing is really forming these interdisciplinary collaborations and partnerships, because then we're leveraging our expertise and we're pooling and sharing our resources. Like you were saying that within the speech community or speech and language pathologist community, there are so many different aspects of speech and language intervention. And the same is true for psychology, which is my discipline. There's health psychology and neuropsychology and child psychology. And so I think that when we collaborate with others outside of our discipline, we have the ability to have a bigger impact. And it almost feels like a seismic shift is possible. Like you're saying, you're connecting with physicians and a neuropsychologist, and you are together, you are addressing the needs of your community in New York, but then also impacting communities overseas as well.
I really love that team approach. I mean, when we were working in Peru, we had an OT, we had speech, we actually were working with adults there too, laryngectomy patients. So we had 2 voice specialists. So depending on the trip, when we were doing in-person mission trips, and then even now with teletherapy, matching the therapist area of expertise with what's needed. I mean, it's amazing to have the occupational therapists there with the experts and whatever the client that we're working with. So here we have the OT that's working on hands, fine motor movement and fixing the wheelchair. And then a speech pathologist that's working with feeding and coaching the parent and the family and the caregivers. And then maybe another one that's working on speech and language. And that to me I feel like we need that kind of care even in the US because there's such a process.
Absolutely.
Yeah, there's such a process to get the other services added, but to have them all together at one time. I mean, there are places that do things that way, but when I was in graduate school, we had a pediatric language clinic and everyone worked together at the same time, and it was amazing. But I find professionals feel that they're more isolated, and we're also excited to join together. So that's one thing that I really love about Smiles for Speech is being able to meet so many different professionals.
Right.
We were supposed to have a physical therapist before COVID. So we would have speech OT. We had 2 nurses that taught hand washing and basic first aid. And, some physicians want to join, and it's very exciting for everyone to come together. I mean,
it sounds very exciting. Yeah. It is. I love collaborating with others as well. And I know we've talked about your private practice and we've kind of indirectly been talking about Smiles for Speech, but can you just explain to our listeners what Smiles for Speech is? And then we'll talk about how other people who might be interested can connect with the organization.
Sure. So we provide right now primarily teletherapy, but workshops and training, parent education. We are creating a library of culturally responsive materials. So we have created them for Ghana, Kenya, and Uganda in English. And then we have Swahili for Kenya. And we're working on Jamaica. We're also going to be working with Rwanda with Southern University. So we have our materials. We have a team of speech pathologists that are doing teletherapy. Some are working with schools. So they're working not only with individual children, but in groups. So working with caregivers and teachers at the school to train them so that they can reach, more children, because some schools have 200 plus children that have special needs. There are no special educators. It's just a residential school, and places like orphanages, which we work with a lot too, they really don't have the access. So they have, these beautiful, loving people that are caring for the children, but they don't have those therapeutic services. So we work closely with them, and then we still have our in-person trips, which we're hoping in 2022, planning to travel, hopefully in February, to Kenya, Ghana, and Rwanda.
Well, it seems like we need to clone you because you can't be in all of these places at the same time. You must have a big team or a growing team of people to reach so many families, so many communities, including all the work that you're doing in New York.
The team is definitely growing. It's very exciting to just start off with me and then one OT and then one speech therapist to now, I guess we have 40 plus volunteers who are giving their time for free. And anytime that I ask for something, I have this family, this and that, they're just right there. And I'm so appreciative of my team and people like you that take interest in what we're doing, because like they say, it takes a village. So it's not something I can do alone. It's my team.
Absolutely. It absolutely does. And again, I just think that the work you're doing is so fantastic and is having a big impact here in the United States and globally. And I would love to, and I look forward to being able to partner with you in the future, because I think that, again, when we work together, we can really maximize our impact on children and adolescents and support what it is that they need and their families and communities need. So thank you so much for being here with me today. This has been a great conversation, and it's really provided a great deal of enlightenment and encouragement and optimism for the future of families who have kids with special needs. So thank you so much for the work that you do.
Oh, thank you for having me. It's my pleasure. And I'm very excited about working together with you in the future.
Yes,
We have
absolutely.
we haven't announced yet, but when they get closer to fruition, I would love to see you be part of that too.
Okay. I can't wait. What is the best way for listeners to get in touch with you, Sandy, and with you and your organization?
So the best way would be hello@smilesforspeech.org.
Okay, perfect. And I will put that information and the link to your website in the show notes. Thank you again for all that you do, for being with me today, because I know your time is precious and you have a lot to do and a lot that you are doing. So I really appreciate you being here today.
Thank you.
Let me know what you thought about this episode. DM me on Instagram at Child Nexus Community, or send me an email at drkiwilson@childnexus.com. I am so grateful to Sandy Dorsey for coming on this podcast. For me, this episode highlighted that the difficulties that children face are universal. They are seen in children all over the world, which means if we can help children in our own communities, we can have an impact in other communities as well. There's clearly, again, a great deal of work to be done to increase access to information, assessments, and therapeutic services. We will be doing our part to collaborate with organizations to find sustainable solutions to inequities in education and mental health services. Thanks so much for listening and for being part of this community.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.